And here at the main stage, we have lean in hospital labs in Argentina and China, and a Brazilian in helping hosting this. Okay, so again, we're the Lean Global Connection. So Flavio, I leave you with Dr. Sala and William to take care of the session.
Thank you very much, Chris. Hello, dear friends from around the world. I hope you can hear me fine. I'm Flavio Battaglia, the president of the Lean Institute Brazil, and your host for the session. I would like to welcome all of you and wish our speakers a great presentation. The next 30 minutes will be dedicated to exploring the benefits of Lean applied to healthcare, especially looking at hospital labs in Argentina and China. Lean thinking and practice have been a source of inspirations for many different healthcare organizations around the world for at least the last 15 years. And during this period, we could testify major improvements and amazing results in almost every type, shape, and size of healthcare organizations in all the 5 continents. But the work ahead is huge. The successful initiatives are still scattered and represent a very small fraction of the world's hospitals, labs, and clinics needs, mostly still struggling to deal with the post-pandemic world. This session is dedicated to inspiring healthcare leaders around the world so we can accelerate the changes and help our patients to get better, cheaper, and safer care. Now, I'm honored to present you our speakers. Here we have William Lu. William is the Lean Healthcare Director of Lean Enterprise China. He's the co-author of the Lean Healthcare in China since 2021, and a lecturer in Lean Healthcare in Shanghai Tech University since 2020. William will talk about how to reduce the waiting time for patients and healthcare staff. And the second part of the presentation will be dedicated to Dr. Javier Sala Mercado. Dr. Javier is the Vice CMO and COO from Instituto Modelo de Cardiologia from Córdoba, Argentina. And he's also the president of the Lean Institute in Argentina. Dr. Javier will share some thoughts and learnings about how to transform a central lab in a very, very interesting journey that he's been commanding for a while. So thank you very much, dear friends. And I would like to hand it to William now. So William can share his screen. And William, please.
Thank you, Flavio. Hello, everyone. I'm William Nuo from China. When we talk about waiting time for patients, we have an assumption that there's conflict between the demand and supply. In a way, we encourage to solve the problem by doing subtraction instead of addition. Today, I would like to share with you a story that to reduce waiting time for patients and healthcare staff at the same time in the clinical lab of a hospital. So as shown in the picture, many patients complained that it took too long to get blood drawing in the clinic lab. Too many patients standing in the front of service windows also gave a lot of pressure to staff. We found 2 key information. The first one, every Monday morning was the busiest time slot with the most volume of patients to get blood samples. It's around 1,000 blood samples every Monday, while there were around 5,000 outpatients on Monday. The second one, we did a survey about how much time you were willing to wait for blood drawing in this hospital, and the answer was less than 10 minutes. There were only 28% of the patients could get blood drawing within 10 minutes on Monday. So we focused on reducing the waiting time for patients on Monday morning. And to understand deeper of the relationship between the demand and capacity, we used takt time and the cycle time. As shown in the slide, the demand was different in different time. We divided the time into every hour, the 3,600 seconds divided by the number of patients waiting within the hour. We got the takt time for each hour. Then use cycle time of blood drawing for each patient. It's 97 seconds to be divided by the takt time. We got the windows needed for each hour. Comparing the windows needed to the windows opened, we could see the gap easily and came up with a solution. To introduce this calculation better, to the managers in the hospital, we created a simulation. So in the morning, 5:30 to 6:30 a.m., there were 23 patients arrived at the window to wait for the blood drawing, but there's no window open so early. So these 23 patients had to wait till to the next hour, 6:30 to 7:30 a.m. The early morning shift began at 6:30 a.m. with 2 windows. And the patients also knew this, so another 113 patients arrived within this hour. There were 136 patients waiting to be served in total. The hourly output is only 37. So we could serve 74 patients with 2 windows in this hour. That made 62 patients would be left to the next hour. All of the 8 windows would be opened from 7:30 a.m. and the real rush hour began. If I was the first patient who arrived by 7:30, I still needed to wait for the previous 62 patients left over from the last hour. So everyone behind me also had to wait. The manager knew the demand decreased from 10:30, and so she reduced 1 window and kept 7 windows opening during this time slot. We can see there's much waste of staff working time from 10:30 to 12 o'clock. Now let's take a look at the simulated situation. We had the same 136 patients waiting. And what if we can open 4 windows in the early morning shift? There would be no patient to be left to next hour. If I was the first patient who arrived at the window by 7:30, I did not need to wait for the previous 62 patients left over from last hour in the previous situation and got served immediately. Everyone behind me also did not have to wait for them. As shown, you can see that we could clean up the waiting patients by 10:30, and we did not need 7 windows from 10:30 to 12 o'clock. 3 windows will be enough. Let's see the result. We can see that in the early morning shift, we increased 2 staff for 2 hours and reduced 4 staff for 1.5 hours. In total, we reduced 4 working hours while reducing the waiting time for patients. The mean and median of waiting time has been reduced statistically with p-value less than 0.05, and the percentage of patients waiting less than 10 minutes has been improved from 28% to 55% with p-value less than 0.05. You can see the picture of the windows. Even though they look unlike the same place, but they were showing the same place because they had the windows redecorated, reducing waiting time for patients and healthcare staff working time at the same time. Okay, that's my story. Thank you all.
Thank you very much, William. Thank you. I would like to encourage all of you to send us the questions. So we're going to have some time at the end. So please let us know your questions in the further information that you would like to have. So Dr. Javier, please, now it's your turn. Could you
Thank you very much,
with us?
Flavio.
Thank you.
Yes, thank you, Flavio. Can you see my screen?
Yes.
Okay, so thank you very much for the introduction. It was great to see, this session and to share this session with you, Flavio, and also William, and to share what we're doing here in Argentina. So the first thing, just a little bit about our institution. It's a small institution, boutique institution. It has 72 beds. We're located in the middle of the country in Córdoba, and we admit more than 7,000 patients every year. And also we receive more than 245,000 outpatient visits every year. We were born in 1977. In 2019, we were recognized by the American College of Cardiology as an international center of excellence, and we founded the Lean Institute Argentina with the help of the Lean Global Network. One important thing for our presentation is that every patient here is free to come. So we do not have a capitation or our own health insurance program. So the patients select us as their provider. And the story that I'm going to tell about is how we actually improved our central lab. Because in 2014, when we analyzed the situation, we had 4 labs, one central lab, one hemostasia lab, one hemotherapy lab, and one bacteriology lab. There was nothing lean about them. So we looked at our area, how we had distributed the work of all these labs. And you can see here the waiting area were hallways. We had different secretaries for the different labs. We also had different sites for blood extraction. So we did a spaghetti diagram, okay, of all the patients that were coming, and we were able to see that there were many, many steps that were repeated, okay? The worst thing actually that we saw was that, several times patients had to see 2 times or 3 times a secretary, and sometimes even get poked twice or 3 times, like we saw there in the April 2014, almost 27% of our patients had to see at least 2 secretaries and be poked twice. So we decided to do a lean transformation of all these labs and unify them, okay, the way we work, to be able to add value to our patients and also the ones that provide care. So we redesigned the labs in this way. We just put a special waiting area for the patients, and they're just 1 secretary and 1 extraction site with 4 different boxes. And we redid the spaghetti, and you can see here that, most of all those steps were actually reduced into 5 different steps. Well, the patient comes in, just gets reception once, and then he gets blood withdrawn, and then he can go home. So we did several things in parallel. So what you can see here is our reception, our box for a blood extraction. Okay, after we applied standard work, we also applied 5S, and we actually increased the flow. You have 2 different doors. The one in the left allows the patient to come in, and the one in the right is the exit door. And everything that is needed for every biochemist is right there at every box. So they do not need to move, and the time is actually very, very efficient. So the most important voice that we usually want to hear is, what does the patient think about us? So we asked the patients before and after we did the changes, what they thought, how much time they were waiting to be seen by a secretary, so to be checked in. And what you can see here in orange is that 36% of the patients thought that they were waiting less than 10 minutes, and 79% of the patients after we applied lean thought that they were waiting less than 10 minutes. Of course, this improvement drove a reduction in the waiting time between 10 to 20 minutes and more than 20 minutes. So the next step was to go and see the biochemist, okay, to get the blood withdrawn. So we also asked the patient, how much time do you think you're waiting for get the blood being withdrawn? And we can see that even though we had a better performance, okay, 62% of the patients thought that they were waiting less than 10 minutes. We were able to improve with the lean transformation, and now 82% of the patients think that they wait less than 10 minutes. I always say think because we asked the patient what they were their opinion, and after that we started measuring, so we now have everything electronically measured. But of course, this improvement for the waiting time before 10 minutes drew down our waiting time between 10 to 20 minutes and more than 20 minutes. We also asked the frequent flyers, so those patients that have been coming for our labs for several years, what they thought, if they had a greater comfort with the new reception. And 98% of our patients said yes. We also asked if they had a greater comfort in the new blood collection area, and 97% of them said yes. And we also asked them if the speed of the processes had improved, and 94% of the patients said yes. So we were very, very happy with these results. And as you can see here, we have put here all the monthly average patients that we see every year. And since 2015, now compare those 12 months to the first 10 months of this year, we can see that we are more than doubling the amount of patients that we're seeing. And the important thing is that we have reduced our FTEs by 24%. So if we want to do like a Gemba walk, okay, we can see here this is our lab 2023, and you can see there on blue arrows, many boards on the sides, and also in green, monitors. These are all the information that tells us how are we doing right now, if we're having a good day, How did we do the last 24 hours? How did we do the last week, last month, and how are we doing this year? So the monitors are used to have all the biochemists on a target for the most critical values. For example, the samples from the OR or the samples for detecting a heart attack, like a troponin. Here we can see that we applied 5S everywhere in the lab. So we have 5S in our refrigerators, our shelves, our drawers. We also worked applying Kanban cards to be able to order our supplies for the 3 different vendors that work with our lab. So here you have in light blue our Kanban cards that are actually sent to our pharmacy, in red the one that is sent to purchasing, and in green the one that is sent to a lab that is outside our hospital. We also standardized every process and every working equipment. So you can see here examples in the left, how we process an oximetry sample, and on the right, how we work to actually calibrate an equipment. One of the key to success and sustainability are our team board huddles. They are very, very important, okay? So we do that in order to see how we're doing. Did we have some deviation, and how can we actually look for a root cause analysis for that deviation? The monthly metrics are separated between quality, security, efficiency, and productivity. Just to show you an example, this is a metric, that tells us how much time our patients are waiting from the secretary to get the blood withdrawn. So you can see here that our target is that more than 95% of the patients wait less than 10 minutes. And we were able to be on target almost every month this year, but March and April. The other metric that we also put there in that monthly wall is, for example, do we have to recall a patient? Do we have to also, tell a patient to come back and get blood withdrawn again? And we study why we do that. So was it a mistake, the way we actually took the sample, the way we processed the sample, or is it something that we need to recheck because the results, we want to make sure it's actually what's going on with the patient's health. So we look into every sample and do a root cause analysis when we know that it's something that we could actually prevent from doing again in the future. We are always looking into our quality. So are we doing okay with the way we work in the pre-analytics and in the analytics? So we participate in international and national quality indicators surveys. This is from the International Federation of Clinical Chemistry. Our numbers are the red dots, and you can see that we're doing great compared to the overall value and also compared to the group values. This is our board to actually control exactly the dates that we need to send all the samples. So these are blind samples that we receive to process and send these labs to tell us if we're on target or not with our measurements. So you can see here on the left, the times left to send the samples, and then on the right, how did we do the month before? So for example, in September, our target was to go above 95% of accuracy, and we were 97.3%. This is a board that actually tells us where each of our lab personnel is working. So for example, on the left side, you can see UTI, that means ICU, and we know exactly who is working this week in the ICU in the morning, who's working in the wards, who is assigned to box 1, 2, or 3 for blood extraction. And we actually know who's working in each area of the chemical analysis. So the processes for the analyzing all the samples. So if something happens, we can go and talk to the person that was actually performing the work to see how we can improve that. So in color, we have current week, and in gray, we have next week. Another thing that we try is to prevent events. So for example, this machine has a QR code that you actually can point with your cell phone, and it tells you exactly what type of countermeasure you can actually apply when an alarm goes on. This is very important because this takes into account uncertainty and possibility of future events and their effects on objectives. Another main target that we have is that every lab of the personnel works on daily equipment maintenance. So this is a technique that consists in carrying all small basic maintenance tasks, and that actually prevents from a downtime or maximizes also our equipment efficiency. What we see here is actually the daily management board of our biochemists. So for example, on the top left, you can see the troponin. This is actually the cardiac enzyme that tells you if a patient has or not a heart attack when the ECG is actually normal. And our door to troponin, okay, I would say excellence will be to be below 60 minutes, and the turnaround time for the lab is to be below 35 minutes. So you can see here that on November 28th, we had a maximum time for 27 minutes, and we were able to be in 100% of the samples below 35 minutes. Below that, we have our time that we actually put the information from all the patients that are in the ICU or in the wards, so their results, the daily results, so the physicians are able to make decisions on what to do with those patients. It's very, very important. If we do it below 9 a.m., when we started working this, it was below 11:30, then it was below 11. Now our target is below 9 a.m. As you can see, we did great on November 29th, 8:58. On the right side, we have how much time it takes for our blood extraction. So this is the daily routine to measure how we did. So we had 100 patients that came in, and the maximum time was 5 minutes, 13 seconds. Underneath that, how many patients we had to recall. It says no recall in Spanish. And then on the right, at the bottom, we have how many alarms came on any equipment that we have. If there was no alarm, you have put a red dot, and means that everything was okay. These are probably one of my favorites, I would say, boards that we have. The one on the left is how can we prevent adverse events with patients, for example, when they have the same name, or how can we speed up the process of getting a diagnosis? So when we send an samples that we do not process in the hospital, we do pool of that information to be able to reach the diagnosis as early as possible. And on the right side, actually, we have our ideas generator board. On the left, we can see the ones that are being considered. On the middle, the ones that are in process. And on the right, the one that all the ideas that have been already accomplished. And the idea for us is that by the end of the year, we have many of these improvements applied by our staff. So the take-home message, that we want to send to you is that the lean cultural transformation has been invaluable to us. Lean is an amazing driver to accomplish safe, better patient care and an efficient use of resources, just like Flavio said at the beginning. And the hospitals need to adopt lean culture in order to add value to patients, providers, the entire healthcare system, organizations, and payers. And we agree 100% with this phrase that Abraham Lincoln mentioned, saying that the best way to predict the future is to create it. I want to thank our team of biochemists that are working, hard every day, doing really an amazing job for our patients. And I would like to thank everybody for your attention.
Thank you very much, Dr. Javier. Amazing examples of how to transform the lab in different dimensions and involving people in a different way. So thank you very much for your presentation. So we have some time for questions here. There's the first one coming. So I think it's a question, I think both of you can answer it. So maybe you can spend like a minute each trying to make some comments on that. So the question is, how did you achieve staff involvement in lean improvements across your organizations? They mean like non-physicians, nurses, physicians. So are they all employees in most part of the time? What do you see about it? So the question is related to how do you engage, how do you involve people in those improvements?
Go ahead, William, first, please.
Okay, thank you. So in my experience, I would like to share 3 ideas. The first one, no one wants to change except some pioneers. So the second one is we need to focus on those pioneers to do some pilot projects or improvements to show what we can help them. So if they can see the results, they can see the benefit, then they may try to attempt a little bit. The third idea is all of the improvements, we should, first of all, we need to focus on patients, but we also need to help the employees, help them to improve their own work. They can benefit it. They can apply it. Yeah, that's it. Thank you.
Thank
Excellent,
you,
William.
Doctor, let's listen from your
Sure.
perspective,
Yeah, so
Dr. Javier.
Yeah, so I would like to add, to what William said, is one of the major important things that we did here in our hospital was to engage leaders, all right? So if we focus on training our leaders, so then actually they can secure time for their group, okay, to be able to train. So I would say education, all right? So it's a very, very important part. Start probably, in our case, it was important to start with model cells. So we selected the areas where Williams mentioned that there are people that do want to change. So we selected those places as model cells. And then that actually created momentum for others to join. But education is very important. Leader support is very important. And of course, the C-suite, the entire organization needs to understand the benefit that Lean gives to your patients and to the entire organization. So I would say that, those are key concepts. And the second, and last thought I want to share is that it's very important for Gemba walks. Okay, so if you can actually go to an organization and see, how they're doing Lean, or bring people to, show you the way they're doing, and sharing knowledge is amazing. The power that has. So Gemba walks in other organizations and sharing knowledge is an amazing thing to do. So that will be cross-pollination through different organizations.
Perfect. Thank you, Dr. Javier. I think we have time for one more question. There's a question here related with accreditation. We know that the healthcare environment, it's full of different types of accreditations. And people are asking, how does Lean connect with the accreditations and the effort to standardize things in such terms? Could you make some comments?
Sure. So I think it's very important to have Lean as a culture to be able to do the accreditations the best you can. In our case, it was actually one of the main interests of following the Lean culture was we wanted to do international accreditations. So we went for accreditations in chest pain for the American College of Cardiology and American Heart Association, and also in heart failure. And due to Lean, it was very, I would say a lot easier, if you want, to be able to improve your processes, okay, and to actually nail the metrics and the objectives that the accreditation give you. The other thing is that sometimes accreditation will give you some steps that you can discuss with the entity, because if you apply Lean, maybe those steps you can put non-applicable and do things even better. So I think the connection between accreditations and Lean is amazing and does a great job.
Perfect. Thank you, Dr. Javier. William would like to make some comments. I don't think we have much time. So I would like to thank you very much, friends, for that. Our time, unfortunately, is over. So thanks for the invitation, for being part of that. And I hope both of your presentations can inspire more people so we can start accelerating the change, because healthcare really needs it. So thank you very much, and I hope you enjoy the rest of the event. And I will hand it back to my friend Christopher Thompson. Chris, it's up to you.
Thank you very much.
Thank you.
Bye-bye.
Thank you, Flavio. Thank you, William.
You.
Thank you, Dr. Javier. It was very nice hearing about Lean Healthcare again.